I'm Kate Myers, and this is a video from Mr. Dawes' health class. And I'm here to teach you about continuous chest compression, CPR, and AED use. So what do you do if someone collapses from a heart attack? Well, say that this person collapsed from cardiac arrest. Well, if continuous chest compression is best for someone who has had a heart attack. If someone has been drowning, has drowned, traditional CPR would be better, but if you don't know what happened to them, any CPR is good, and but studies have shown that with cardiac arrest that continuous chest compressions actually saves more lives than traditional CPR. So for right now, I'm just going to teach you this new form. So what would you do if someone collapsed of a heart attack? First, what you do, obviously, is rush to their aid, because every minute that you delay CPR, their chances of survival drop by about 10%. So first what you do is obviously you'd run to them and you'd make sure that they were laying on their back if they weren't already. And you'd want to check for their responsiveness, so you'd want to shake them and loudly ask, "Are you okay? Are you okay?" Now obviously, since they've had a heart attack, you weren't expecting really a response. You might want to rub their chest a little bit, or just check for responsiveness in general. You'd want to remove their clothing next, and immediately ask someone to get 911. If no one's available, you might want to do it yourself. Well, you would want to do it yourself. If someone else is available, get someone to get an AED machine. And you want to start continuous chest compressions immediately. So you want to put the heel of your hand between their nipples, or where their breasts would be. If they're a male, obviously probably won't have them. And you want to put your other hand on top of that and interlock your fingers. And you want to lock your elbows, because you're not strong enough to do 100 beats per minute. So think roughly, you'll be pumping to about, like, staying alive, like, staying alive. So, and you want to go pump till it's about 2 inches down into their chest. And when you come up, you want to make sure that your hand lifts off their chest to allow recoil, so that the vacuum, and you can allow the blood to effectively pump. So you'll start just giving CPR continuously, and don't stop until paramedics arrive or an AED arrives. And if an AED arrives, stop and immediately place the AED on the victim. And the AED should have instructions on how to place them, but you're going to place one pad on the right side just below the collarbone, and one pad on the left side just below the breast. And once they're placed, the AED will begin to analyze the victim, and it will determine whether or not a shock is advised. And if a shock isn't advised, it will tell you to continue CPR. Do not remove the AED until the paramedics arrive, even if the victim shows signs of life. Just leave them on, because you never know, they could go back into cardiac arrest. So if a shock is advised, it's going to tell you to stand clear. So you're going to make sure that everyone is clear. You're going to say clear very audibly. You're going to make sure that everyone is clear, and once you're sure that nobody is touching the body and that everyone's away, you're going to press the button that is indicated very clearly on the machine, and it's going to deliver a shock to the body. After a moment, it's going to tell you to continue CPR again, leaving the pads on. You are going to continue giving CPR. Now the machine is going to continue to reanalyze the victim every 2 minutes, and it might deem that another shock, and every time it reanalyzes, you're going to step away from the body again, and it's going to reanalyze, and then it'll tell you whether or not it wants to give you another shock, and then you're going to continue CPR. And you're going to keep doing this until the paramedics arrive, or, the person dies. Or, that you're for sure that they are totally and utterly alive. But even if they are showing signs of life, you're going to want to keep giving them CPR until, they're walking around totally okay. For sure.